at all the data.
Continuing medical education courses such as these for pain management and opioid prescribing methods are not required for physicians in the state of Arizona, even in the thick of a national opiate addiction problem.
There's an issue, frankly, of education, of provider education. The studies will show you that about 80% of the opioids are prescribed by about 20% of the providers. So there are physicians or providers that potentially need a little bit more education.
For a long time, medical students and doctors say they were taught to treat the pain, treat the pain, treat the pain. They also say they were misled to believe that painkillers were not highly addictive.
If you were treating a patient for pain, they would not become physically dependent or addicted. And so there was a level of comfort with treating these patients with narcotics.
Tim Morrison, the father of a recovering addict, says there should be required continued education and that ignoring the issue is inexcusable.
When Brett our son was in a hospital and notified the hospital and the nurses that he was a heroin addict. When they released him, they gave him a prescription for OxyContin. When my wife approached the nurse and the doctor about it, their comment was, well, we don't treat addiction.
The Office of Continuing Medical Education at the University of Arizona developed an optional online course on how to prescribe opioids and handle chronic back pain.
We have to approach this from an education side, the prescribing providers, the patients, their families. We also have to make sure that we're using the evidence-based practices and approaches to the treatment of acute and chronic pain that are most appropriate for that individual patient.
Berman said patients need to be made aware of all of their treatment options, and Sywick added that to prevent overdoses, they need to understand the strength and risk of opiates.
The patient hasn't been made fully aware of the potency of these medications, of the complication when you mix medications with alcohol, when you mix opiates with that sleeping pill, that benzodiazepine that your primary care physician gave you.
Part of the online course was funded by a grant from the Arizona Department of Health Services. Officials have offered the course since 2015, and so far, 500 prescribers out of more than 13,000 physicians in Arizona have registered to take it. In Phoenix, Kate Pfeiffer, Cronkite News.